but you've identified the 5 core capabilities that would be helpful to a doctor.
Themes, actually.
Themes, if they're interested in doing volunteer work.
Yeah.
Okay. Which, by the way, I think this is really important. We talked about the ramifications of homeless and homeless illness on society. We don't have the statistics, unfortunately, but the statistics, I'm sure, are substantial. One shouldn't forget that if you are homeless, the likelihood of you needing medical attention is fairly high, much higher than a normal citizen, right? Yeah. So let's say we have in Austria, we have 35,000 homeless people. Think about the strain this has on emergency services, hospitals that have to deal with on a continual basis. And sometimes homeless people have the tendency, they might get picked up by an ambulance, which costs money that they're not going to pay. There's no insurance for them. They bring them to the hospital. They sit around there. They get treatment. They might stand there. And then before they know it, they leave the hospital. And 2, 3 days, 4 days, they're back for the same thing. So this is an endless story.
Also in one day. Yeah. If they're not picked up, they stay there. They don't want to go with the ambulance. The ambulance don't want to argue, or they don't want to pick them up. Whatever reasons might be. One normal patient might need an ambulance once. 4 times a day,
and
maybe.
A hospital, and a homeless person might need.
I mean homeless people.
Yeah, but I'm talking non-homeless person only needs one ambulance.
Yeah, one ambulance, one day.
And a homeless person might need for the same situation.
4 times.
4 times.
And that's what we also do. Is we do interdisciplinary education. So we don't.
Let's. I love the fact you're all over the place, but that's my job to keep a little bit of structure.